The WHO warnings are based on data collected from 450,000 patients admitted to hospitals for COVID-19 in 65 countries over a 3-year period between January 2020 and March 2023. During that time, they found a widespread misuse of antibiotics. While only 8% of hospitalized patients with COVID-19 had bacterial co-infections requiring antibiotics, 3 out of 4 were given the drugs just in case they helped. This, it is believed, could lead to microbial resistance where antibiotics lose their effectiveness.
The main harm, of course, is that if you're using antibiotics, you're increasing the likelihood of antimicrobial resistance to those particular antibiotics, so that when you do need them for your bacterial infection, they are no longer so useful.
The WHO says that antimicrobial resistance is one of the leading threats to global public health. When antibiotics and other antimicrobial medicines become ineffective, infections become difficult or impossible to treat, increasing the risk of the spread of disease, illness, disability, and death. It is estimated that such resistance was directly responsible for 1.27 million global deaths in 2019 and contributed to 4.95 million deaths in the same period.
If you look at the misuse, because people try to think only, only thinking in terms of people treated by antibiotics, but it's more than that. There's a misuse and a total overuse of antibiotics, not only in humans, but also in animals and plants, and that will drive the development of drug-resistant pathogens as we go forward.
And the problem may be more acute in Africa. While prescriptions of the medications decreased in Europe and the Americas during the pandemic period, they increased across the continent. Analysts say people should understand how antibiotics work.
We need to make sure that, first of all, that the healthcare people prescribing these antibiotics know exactly what they are doing. We need to educate the people out there that you don't need antibiotics for each and every ailment that you get. Sometimes you have to, unfortunately, ride it out. And then we also need to make sure that you cannot just buy over-the-counter antibiotics.
However, with increased supervision and surveillance, health experts believe the world can tackle the problem of antimicrobial resistance. Wilkisangabo, CGTN.